There are actually several major reasons. First of all, people actually want it. There were many studies conducted looking at people's desires to have their spiritual or religious concerns addressed by the health professionals. And they actually found that a large majority of people actually want these concerns to be addressed, not just by their faith leaders, but actually by the health professionals. In the United States, they actually did a major study. They looked at inpatient admission data from 1.7 million people across the United States. And they found that spiritual or emotional concerns rank second in their priority, meaning that people really want these spiritual and emotional needs addressed by the health professionals. Working in Canada, I work with a lot of Asian people in Toronto, Canada. And one thing I identified was they have a lot of trust in the faith leaders, many more so than the trust in doctors. If I want to actually provide optimal mental health care to this population, I found that I need to make sure that the faith leaders involved in the care of these people also have an accurate understanding of mental health issues. Professional organizations have also recognized the importance of the collaboration between psychiatrists and faith leaders. For instance, the Royal College of Psychiatrists in the UK had published a position statement in 2011. It's called Recommendations for Psychiatrists on Spirituality and Religion. And in that particular document, they had listed 7 points. So one of the points was psychiatrists, regardless of their own beliefs, should encourage themselves and also their colleagues to collaborate or work with other faith leaders. Some people during, let's say, psychotherapy sessions would bring up spiritual or religious concerns. And sometimes if you don't have these concerns addressed, it would impede the progress of the treatment. Other times, people would present in a way that the mental health professionals might not be sure whether it's actually, for example, spirit or demon possession. And they may actually need an opinion, from a faith leader. A lot of times, as shown by different studies, people would actually go to their faith leaders as the first responder or the gatekeepers when they actually have an emotional or mental health concern. So instead of going to see a doctor or see a counselor, they go to the faith leader. And so faith leaders act, in the capacity as the gatekeeper. And a lot of times, research has shown that they may not feel prepared to actually provide such services. And so it speaks to the importance of mental health professionals and spiritual leaders would need to support each other by collaboration.